Okay, so we have some questions that our attendants from Zoom attendants, virtual attendants, sent us. One of them was for the previous panel. I think they say, can you give some inputs on the MDR compliance for AI software to get the CE marking? How is it affecting the update or upgrade of already existing AI models with new training data?
I am looking at Anna because I think she's the most knowledgeable person to reply to this, to give her comments.
Yes, well, I think that's a very good question, and absolutely, it's time that you upgrade your AI model. You need to recertify it. However, it's not the same process as you do in the first time. So in the first time, it's a very long process of all the documentation, all the technical stuff, etc. But if it's an update on the performance, if you just validate and you show the performance on the new model with the same data or new data, etc., is enough. So you need to tell what is called the notified body in this case. However, it's not so long, but it is true. It's time that you do, even if it's a minor change, you need to check with the notified body that you can say that your product is certified, and with this improvement as well.
Thank you very much. Thank you for these comments.
I can continue. I have another question. How does the implementation of electronic health data space facilitate and influence digital projects within the healthcare sector? And what role does it play in shaping the future landscape of health data utilization? That would be for my session with, I don't know, Magda or...
Maybe we could have a comment from Magda from the legal side, and maybe Luis, I don't know if you would like to comment, because the EUCAIM is implementing the European health data space, part of it, and I could also make a comment, I think we can say quite a lot on this. It's a big topic. Magda, would you like to start from the legal side?
Yes, sure. How does the implementation of electronic health data space facilitate and influence digital projects within the healthcare sector? And what role does it play in shaping the future landscape of health data utilization?
Yeah, that's a lot to unpack. My experience working in INCISIVE and in some other projects is that definitely there is a lot of interest in this European health data space, and everyone is watching closely. Some projects are even trying to shape this proposal, because we are still at the proposal stage. So the first draft that was proposed by the Commission last year is not the final one. There will be legislative work on it, and I think it's good that this draft has been the point of attention of the health projects, because they really understand where are the tricky parts, what is the most difficult. I think it's a big role of the health data projects to try to influence how this draft will be shaped at the end, and that it really plays the part that we are hoping that the goals that will be achieved, so that there is a clear pathway and clear incentive to share the data, to do it in a responsible way, in a privacy-preserving way. But I still think there's quite a lot of questions that need to be answered before we get there, and especially for international projects where the data is flowing from different data providers. The draft doesn't specifically address that. So maybe that's one legal take on this question.
I could also comment, and then I would like Luis to comment as well. Luis, you can come and join me, because we will be closing this event together, and Thanos as well. So we might as well. Yeah. I will also comment on how my view of the European health data space current status is. My understanding is that it is going to be a big facilitator for health data sharing and for wider availability of data that are necessary for innovations. But it's not going to be a panacea. We can already see this even when the draft is consolidated and accepted by stakeholders. It will have to be an evolving thing. It will not provide all the solutions, not from the technical side, not from the legal side. There will be still many open issues, and I think that the Commission's approach on consulting with our projects, with other ongoing projects working in all these relevant areas is the right one. Because eventually, even if the guidelines, because the European health data space will be about regulation and guidelines, even if these are in place and accepted by everyone, we will still need to apply them. And this is where our role is. As data providers, as technical partners, as legal experts, we will all need to input our knowledge and expertise and application of this to make it, real.
Yeah, well, just to comment also on the how important is that European health data space, not only for clinical practice, also for research in both aspects. And in our part that deals with the standards and interoperability, I mean, those things are critical there. And we have a huge amount of knowledge, all of us, on standards and interoperability, because we are doing that in the projects. So it's quite important to have a voice on that European health data space working group and commission and so on. And on the other part is that, at least on my understanding, that will facilitate the access to the data. And that's a huge amount of troubles today, as we saw on all the projects, that we are data scarce. I mean, we think we need data, but data is extremely difficult to be picked up. So if there is a regulatory framework at the national level, where we will have those, let's say, doors where we can knock asking for data, that will be a huge improvement in the way we are doing that. And quite important, at least in my understanding, the European health data space also recognizes the role of the infrastructures for that door to be knocked. So it's quite relevant that at least EUCAIM, if we finalize as an infrastructure, that's what should be, then we will be one of those open doors where researchers could ask for data, and we will be able to provide that, no? So that will facilitate.
Thank you. I don't know if any of the other participants here would like to comment anything. Feel free. Okay, good. Did we have more questions? No. Okay. So please. Oh, yes, please. There is a mic.
Thank you. Up to what point are we putting so much stress in having the perfect AI solutions before actually adopting them in the clinical practice? Because a lot of time there are a lot of misdiagnoses, in cancer. And I'm thinking in the primary care, especially. I see that if a doctor is complemented by AI, there could be a lot of cases of cancer that would be detected earlier, So I don't know if what is the health system holding it back, in actually massively deploying these solutions.
I think our clinical experts may want to comment on this.
The question was on...
I will try to refine based on a personal experience. My wife was misdiagnosed with a cancer 3 years ago. She went into the emergency with an abdominal pain, and she had an X-ray, taken, and she went sent home with the diagnosis that it has acute constipation, let's say. After 2 weeks, she was getting surgery, emergency surgery, because it was an ovarian tumor, 10 centimeter by 5, right? So actually I thought at that time, if this doctor would have had an AI software, at least to have an alert that this could be a tumor, she could be have sent for further explorations, right? So, and this is not just one case. I have a lot of people that I know that even having controls year by year are detected cancer at a late stage. So what is happening in this health system? Why are not we deploying these solutions, even when these solutions are not actually precise 90%, but if they are precise 75%, wouldn't be that actually enough to have that support for the medical doctors that most of the time are tired, are bad paid, they don't have actually the knowledge to diagnose these type of things? That is my question.
Let me summarize what I do understand is happening. No? Well, first, we do not need perfect tools. I mean, that's for sure. We only need tools that are better than what we did have before. If there is an improvement, a gain on accuracy, or a gain on sensitivity or specificity or whatever, if you prove that the gain is there, then you might use those tools. But in medicine, we need to use tools not for research, but for clinical practice, and those tools have to be approved by the regulatory agencies, and to be approved has to be validated, as we learned before. So that's a process that has to be done. That means that maybe we can think, well, this should be used today, but there is not that fast. No? Having said that, in most hospitals today, we are using AI. So we are using that. We are using AI for image reconstruction on the machines. That means that images are much better, and we can evaluate more patients in a better way. But we are also using AI on diagnosis. I mean, we are using AI to pick lesions in my hospital, in my department. We are now using several AI tools to help radiologists on their report. So those things are being used, no? But it's not something that will be used everywhere. First, because you have to pay for that, so it's not for free. Second, because still we do not have a huge amount of tools. They have to be approved by the regulatory agencies. And third, because still we need clear evidence, no? And evidence means a huge amount of cases, and to trust on the solutions and to be confident on. But we started that way, all the hospitals, and there is no way back. I mean, once we started doing that, we recognize the gain on what we are doing for the best of the patients. So we are in the process.
If I may also complement what Luis is saying, from my personal perspective, I'm not a clinician, but I have worked with a lot of clinical experts in the projects. I feel that one part that is still missing for the full exploitability of AI, apart from the technical issues, the preciseness and all that, is the education. And I think one of our previous speakers in the panels mentioned that the education of medical doctors on how to take advantage of AI, because AI is never going to be 100% correct. So they need to be trained to understand the limitations. There will always be small biases, small defects in the way AI is functioning. It can still be very, very useful. But medical doctors need to be trained how to use it, need to understand their limitations of AI tools in order to be able to fully take advantage of them. And with that, I think, please, our keynote speaker and our co-organizer, Luis, we would like to to close the day, I will start commenting what my take is from what we heard today. We heard about a lot of technologies, a lot of infrastructures, a lot of solutions on data interoperability, GDPR compliance, all these challenges. We heard a lot about hanging fruits, and I do hope that by the end of the day, most of us will take advantage of these to reinforce data sharing and to even enhance it further. But my take from that is that there will always be challenges, there will always be risks, because we are talking about sensitive personal data. What it comes down to in the end is a decision and risk mitigation and deployment of all these hanging fruits, low-hanging fruits, to be able to overcome the challenges, to mitigate the risks, and share the data, because eventually the benefits are indeed much more than the challenges and the difficulties. And I do hope this is a message that all participants and speakers and contributors to this workshop take back and even help to spread the word even further than today's event. Luis, please. Your final remarks.
Well, only just one short. I'm extremely happy on what we did today from my point of view, integrating things like pathology, medical imaging, laboratory, maybe genetics. Is extremely relevant. We have the tools today to do that. I mean, it's a huge amount of efforts, but we are able to do that. And we are really on the right position to be heard by the European Commission, to be funded by the research projects, and to keep the lead on this integration. So I hope we will do again a meeting like this at least every year.
For sure, for sure. Sano, inspire us for the closure of this event again.
All of this has been very inspiring for me, and thank you for this. And I also want to thank the gentleman about putting us where we should be, right next to the patient. So thank you for this. So we started the day with sharing, and it was a common theme and thread across the day. Data sharing. We need to be sharing data, sharing insights. And we also heard a very, very strong, but I think accurate reflection that no data, no game, right? We need data. What I think is particularly impressive, and you touched upon this just now, is the interdisciplinary nature of these initiatives and the need that we need to be more interdisciplinary still. You've been doing a great job throughout these projects with bringing together all those different experts. And it's something that a few years ago I think was unimaginable. It was no way. We're speaking different languages. But it's happening, and it's clear that there's collaboration, and it's getting better. And so, of course, there will always be challenges, and it was an interesting theme across the slide decks as well. Challenges, and then solutions, and then approaches, and it's indeed never perfect. It will never be perfect, but progress is being made, and when things will be always challenging, I think that the key, the driver, the inspiration really should be when we're talking about oral disciplines and we, either sitting in the couches, in the lab or in meeting rooms, we bring back the patient to the discussion. We think about what we can do to help the patient, the caregiver, the citizen who needs to be screened and tested and diagnosed early. So we will go back to our office, and when we go back to our labs, we remember this is what it's about. Thank you.
And with this, to thank everyone, all the attendants of the workshop, the speakers, the organizers. Thank you very much for attending and contributing to it. Thanks.